Hello everybody, I'm Dr. Max, and we're here today in Hair by Dr. Max Restoration Center in Fort Lauderdale, Florida. And Jerry, he's a patient of mine and becoming a good friend of mine too. And he's here today after 6 months having a procedure, hair restoration. We just finished maintenance treatment with the PRP, and he was really nice by agreeing to give a little interview, just describe his experience. Let me just give you a little background. Jerry came 6 months ago because he was having some advanced hair loss in the frontal and crown areas of the scalp. We decided to do an FUE procedure, follicular unit excision procedure. We planned initially with about 3,300 grafts, right? We ended up actually getting a little bit more, 3,700 grafts. In his case, the more we were able to get, the better it is, because we had to deal with big area like this here. Everything went fine. So now what we see is actually initial results, because usually we see about 60, sometimes 70% of the expected results by 6 months. So now's your turn. Why you decided to have this life-changing procedure with us?
Sure. So me and my brother John, we came down. Dr. Max came highly recommended, and I'm a little queasy when it comes to blood and stuff like that, but Dr. Max kind of just eased that all for me. He was involved every step of the way, from the first, needle going in, taking my blood for the PRP treatments, down to every follicle extracted, every follicle put back on my head. Long procedure, but it was definitely worth it. The lunch was good in between. And no, but I mean, Dr. Max is hands-on. He was there every step of the way, and it kind of eased my, nerves a little bit, because it is a little nerve-wracking coming in. I watched a lot of videos, we did a lot of research. Very happy with my choice to choose Dr. Max.
Thank you. We try to change the industry by kind of leading as an example, because most of the time, and it became a standard in hair restoration industry, that doctor involvement is very little. So doctors are usually in supervisory role. Either, sometimes they harvest, most of the time they're not harvesting, they design a hairline, give the anesthesia, and then the results are sort of dependent on the proficiency of the assistants. There's no way to measure it, and when you have more than one assistant, that could be an issue. Okay, so we decided to sway away from this model, and I took the personal lead, and I do the procedure, everything from the beginning to the end, 100% of the time on every patient myself. And we perfected that because we are twice as fast as the traditional model, and that's why we are able to perform longer surgeries, bigger surgeries, like
4,000 grafts one day.
Yes, like in your case, right? So you can see we're talking about Norwood 6 at least, approaching Norwood 7, and we're able to achieve this type of result with 3,700 grafts. You'll probably need more grafts to get more coverage, but still at 6 months, it is pretty impressive.
And another thing I remember coming into the procedure, the hairline, I was kept thinking about the hairline. I didn't say anything, but I kept saying I want it to be natural, I want it to be natural. And before I could even say it, you said, we're going natural. We're not going to lower it. You're not going to change it. We're going to fill it. And I think it makes a big difference. It looks
and you can see, and now Jerry can finally look at his age, or even younger, right? How old are you now?
28.
28, right? So you probably dropped to 25, right? Having a new hairline, right? So, and it does make him look very different, right?
The confidence level is through the roof. It changes the way you think, you go about it.
It's not only aesthetic part, but most people are affected because it does cause some insecurity feeling. Absolutely. Right? So once you restore that, all the aspect of lives can improve as well, right? Again, this is not something that has to be done by everybody with hair loss, by no means, because it is a psychological factor is the most important one. Somebody who is happy to be bald, there's nothing wrong with that, okay? This is personal preferences, and there's nothing wrong with being bald, okay? And some people like that, but people who are affected, this really makes a big difference in pretty much every aspect, right?
Absolutely.
All right, so would you recommend?
I would recommend, if you want to come for a treatment, I would recommend doing the interview with Dr. Max beforehand. You know, ask any question. I must have called you, FaceTimed you, texted you, I don't even know how many times. He answered every question.
York, right?
Yeah, we came from New York. He answered every question. Kelly in the front office answered every question. The Boost by Dr. Max, I love using it every day. I can see the results with that. And absolutely, I would highly recommend Dr. Max to do a hair transplant.
All right. Thank you so much. And we'll see you in 3 months, right? For the next follow-up.
Thank you.